Welcome back to Aging and Awesome. Dr. Thomas Toe is a renowned health cardiologist. He's joining us on the show. Thanks so much for taking the time, Dr. Toe. A huge problem that affects so many people, whether it's heart attacks, heart disease. What are some things you really need to consider?
There's several modifiable risk factors that we consider. Number one is obesity. Number two is high blood pressure, diabetes, high cholesterol, and smoking. Lowering the LDL, which is one of the factors that could increase the risk of heart attacks, the bad cholesterol. Getting on medication early on is crucial. Talking to your physicians, primary care doctors, or cardiologists to optimize primary prevention steps would be very helpful.
Are there symptoms that you can look for that might be leading to heart problems?
So what I would usually characterize those symptoms into two categories. Number one is the traditional obvious symptoms, which is chest pain, shortness of breath. However, there are heart attack patients who could present to us with very subtle symptoms. The whole point that I would try to convey is as long as you feel something different, as long as you feel something is not at your baseline, that is something that you should have it looked at. So listening to your body is the most important aspect of identifying the signs and warnings of heart attack. Early time is tissue, so the earlier you get treated, the more efficient that is and the less likely that you will develop further deterioration of the muscles of the heart, which could potentially lead to heart failure.
I think a lot of people at home are scared to do that, to admit that they have a big enough problem to go to the ER, even to an urgent care if it's not too serious, right? It's just seeking help when you see those symptoms.
We usually tell our patients that we would rather be wrong than miss all the symptoms. So again, if you have any type of difference or notice any difference in terms of how you feel on a daily basis from your baseline, you got to have it checked out.
Any questions from our live studio audience about heart health for Dr. Toe?
What I was wondering is if someone's having heart issues, what are your thoughts about them getting the COVID vaccine?
So thank you, Marsha, for your question. The vaccine does have side effects that might exacerbate those conditions, but it depends on who you are as a patient. So I would definitely get in touch with your physician and to assess all those risk factors at an individual level to see if the vaccine benefits you or would pose more risk for you.
Well, I simply wanted to comment that not all heart attacks are painful or dangerous. I was doing a Need for Speed racing car down in south of Reno the other day. I suddenly felt like I was having trouble breathing. So I stopped, got out, and everything was fine. But my next annual inspection, I found out I had a heart attack while I was running the cars and ended up with 2 stents. So if you have any question at all about an odd feeling, get checked.
Thank you, Louis, for that comment. As mentioned before, that further validates my earlier point. As mentioned, heart attack symptoms can be divided into 2 things: your conventional chest pain type scenario versus something that Louis experienced at the car racing situation, for which it could be very subtle. So therefore, I want also to emphasize the point that if you were to feel anything different or deviated from your norm or your normal daily life, how you feel, then definitely should have your condition evaluated by a physician or a care provider. Absolutely.
Well, great questions from our live studio audience. Thank you all so much. Dr. Toe, thanks for coming on Aging and Awesome.